Dr. Elluru Santosh Kumar. I am the lead consultant radiologist at United Hospital, Jaipur. Today is 8th June, that is World Brain Tumor Day. So it was started by German Brain Tumor Association to raise awareness and to educate people about brain tumors. What are brain tumors? Brain tumors is nothing but abnormal growth of the cells in the brain and its surrounding structures. So it can arise either from the brain or the layers which protect it called the meninges, or the nerves which arise from it called the cranial nerves, or the endocrine gland called pituitary gland which just lies below the brain. The brain tumors can be classified as either primary brain tumors or metastatic brain tumors. What are primary brain tumors? Primary brain tumors are the tumors which arise de novo in the brain. That is, the cells causing the abnormal growth lies in the brain itself. Whereas in the metastatic brain tumor, the cells, cancerous cells from other parts of the body spread to the brain and then they multiply in the brain to cause tumors. These are called metastatic brain tumors. And again, the primary brain tumors can be classified into benign and malignant. So the benign brain tumors are those which grow slowly, do not invade the adjacent structures, and also do not spread. So these are usually indolent and can be treated by surgical resection, and they are usually completely curable. And the malignant brain tumors are those which grow rapidly, spread to the other structures, and also will have a poor prognosis. And these usually cannot be treated by surgery alone, and they will be in the need of chemotherapy or radiotherapy. Why do we need to know about brain tumors? Because it is the most common solid tumor in children and adolescents, and it is the second most common cause of cancer-related mortality in children and young age and middle age. And also it is the seventh most common cause of tumor in adults. What causes brain tumor? There is no single cause for it, but there are few risk factors which we need to know, like family history and radiation to the brain, and also any cancer in the body is a risk factor for metastatic brain tumors. Manifestations of brain tumors is very vague and non-specific. They can present with headache, nausea, vomiting, gait disturbances, visual disturbances, speech deficits, and also seizures or fits. Due to this non-specific and vague presentation, diagnosis of brain tumors become delayed. The clinician should evaluate thoroughly regarding the patient's symptoms and then refer to the imaging modalities for diagnosis of brain tumors. So the diagnosis of brain tumors is mainly by imaging like CT and MRI. CT is a modality wherein the patient goes through a machine where the X-rays are projected at different angle to get the images of the brain. So there are few advantages of CT over MRI. Like the CT is easily available, it is cost effective, and the scan times are very low, and the bone morphology and the structure is better visualized in the CT. CT is usually done for the initial diagnosis to see the post-op complications and also in follow-up of benign tumors. MRI has few advantages over CT, like it is very capable in diagnosing tiny tumors which are not detectable on CT, and also it can characterize the tumors into benign and malignant to some extent, and also it is useful in prognosis and the treatment part by telling whether the treatment is effective or not in cases of radiotherapy or chemotherapy. Once the diagnosis is done by imaging, it can also give the information regarding whether the tumor is benign or malignant. And usually the benign tumors can be followed up if there are no symptoms and the tumors are small, and it can be surgically resected if the tumors are large and if there are any symptoms pertaining to the tumor. Treatment of malignant tumors usually depends on the size, site, and the characteristics of the brain tumor on the imaging, on the histology, and also the molecular characteristics. So usually the malignant brain tumors are treated surgically along with radiotherapy and chemotherapy. Here at United Hospital, we have a 384 slice CT scanner with dual energy capabilities, and which can produce high quality images of the brain and also better images of the angiography and the 3D models. I hope this video was informative, and also please have a close look on your close and loved ones regarding the brain tumor symptoms. Thank you.